Hello, we are live with our amazing public health team at Assuaged, and we have an amazing panel on team today. And we have Soleil Zamora, we have Evan Schneider, and Catherine Gray, and we have Emily Guerrero. I hope I said that right. And we are waiting for one of our other panelists, Janan. Hopefully, she can join us as we go on with the PowerPoint presentation today. And we're talking about diabetes. There are many ups and downs with diabetes. And so there's just so many things that you could learn. And I will allow Soleil, if you will, go through the presentation and just give it all you got and rock it.
Awesome. Thank you, Cynthia.
Thank you.
Okay, so first we will begin with just the general what is diabetes. So diabetes is a condition in which the body does not properly process food for use of energy. So usually when we eat food, it's turned into glucose or sugar for our bodies to use as energy. But when you are a diabetic, your body either doesn't make enough insulin or can't use its own insulin as well as it should. So these sugars cause a buildup in your blood. So there are two different types. There's type 1 and type 2 diabetes. And the main thing that differentiates the two is insulin. So if you're a type 1 diabetic, you don't have any insulin production. And if you're a type 2, your body doesn't respond to insulin. So normally type 1 is genetic and you often develop at a young age or you're born with it. And type 2, you develop later in life and it can lead to increased weight and it can be caused from lack of exercise or stress. Continue.
So in terms of type 2 diabetes symptoms, they often develop over multiple years and they can go on for a long time without being easily noticed. Sometimes they aren't noticed at all. And type 2 diabetes usually starts when you're an adult, though more and more children, teens, and young adults are beginning to develop it. And because the symptoms are hard to spot, it's important that we know the risk factors for type 2 diabetes and for you to visit your doctor if you were to have any of them. And some of them that are listed here are constantly being thirsty, losing weight without trying, having blurry vision, numb or tingling hands or feet, feeling very tired, and having sores that heal very slowly, just to name a few. And then in terms of the risk factors for diabetes, what puts you at risk for type 2 diabetes is number one, being pre-diabetic. And what that entails is being overweight, being 45 years of age or older, having a parent, brother, or sister with type 2 diabetes, being physically active for less than 3 times a week, having gestational diabetes at one point in your life, which is diabetes during pregnancy, or given birth to a baby who weighed more than 9 pounds, and also minority populations such as African Americans, Hispanics, Latinos, American Indians, Alaska Natives, and even Pacific Islanders are at a higher risk. If you have non-alcoholic fatty liver disease, you also may be at risk for type 2 diabetes. And what can help prevent this from further progressing or increasing your risk is by having lifestyle change, such as losing weight if you are overweight, eating healthier, and getting regular physical activity. As we can see in this diagram here, there's a pretty continuous causal loop. So if it runs in your family, it might lead to unhealthy eating habits from your parents that may have developed. And this can also coincide with lack of exercise and cause you to be overweight, which puts you at high risk for diabetes.
All right. So what causes diabetes? Insulin resistance occurs when cells no longer respond normally to insulin. But what is insulin? Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into the cells in your body for use as energy. However, if the cells can't respond to insulin, then the sugar created from the breakdown of the foods we eat cannot enter the cells. If sugar cannot enter the cells, the sugar remains in our bloodstream. As the sugar level in your body increases, it begins damaging the body, especially organs such as the heart, kidney, and eyes.
Okay, so here are some demographics of who is affected by diabetes. So this graph represents the age adjusted estimated prevalence of diagnosed by diabetes by race, ethnicity group, and sex for adults age 18 years or older. So we can see from this that among U.S. adults above the age of 18, the prevalence of diagnosed diabetes was highest among American Indians / Alaskan Natives, people of Hispanic origin, and non-Hispanic African Americans. American Indians had the highest prevalence of diagnosed diabetes for women, and they also had a significantly higher prevalence of diagnosed diabetes for men. So for a person with an ethnic or racial minority, there's a lot more health disparities which are affecting their life expectancy and decreasing their overall quality of life, and the loss of economic opportunities, which leads to a lot of injustices. So for society, these disparities can translate into decreased productivity, increased healthcare costs, and social inequities. Because a lot of people of color are more likely to not have access to healthcare or have healthcare in general. So a study in 2017 showed that 10.6% of African Americans were uninsured compared to 5.9% of non-Hispanic whites. 16.1% of Hispanics were uninsured, 17.3% Asian Americans were uninsured, and 14.9% of American Indians and Alaskan Natives were uninsured. So just overall, we can see that people of color are more likely to have poor health, which is why they're more likely to be a diabetic. And in terms of women, usually females have more serious complications when they do have diabetes compared to men, but men are more likely to carry diabetes. We can go to the next slide. So then these are the demographics of people diagnosed with diabetes in terms of locations in the U.S. So this graph shows the trend in geographic distribution of diagnosed diabetes prevalence among adults above the age of 20, and it compares it from 2004 to 2008 and 2016. And you could see that the largest percentages are in the south eastern region of the U.S., and that's where more than 10.3% of the adult population living with diabetes is. And then in terms of what we talked about on the last slide with race, people of color make up 42% of the population living in the southeastern region compared to 36% in the remaining of the United States. So people in the south eastern region are more likely to be poor and live in areas of poverty. So this affects all health access and health outcomes, including chronic illnesses like diabetes. So higher rates of diabetes and obesity for adults are concentrated among the southern states. The states with the nation's highest adult diabetes rates are all in the south, as well as the highest obesity rates.
So there are some long-term effects of diabetes. Poorly controlled blood sugar can lead to a range of health problems over time. The longer an individual has diabetes, the higher their risk for complication becomes. Many people with type 2 diabetes have issues with high blood pressure. If this isn't treated, the risk of heart attack, stroke, vision problems, and kidney disease can increase. For cardiac long-term effects, over the time, uncontrolled blood sugar can cause damage to arteries. People with diabetes are more likely to develop heart disease. They have an increased risk for high blood pressure, which damages the blood vessels caused by restricted blood flow from heightened glucose levels. For visual long-term problems, diabetes can cause damage to tiny blood vessels in the eyes. This increases chances of developing serious eye conditions, such as cataracts, glaucoma, or even complete vision loss if diabetes is not diagnosed and treated at an early age. Other long-term effects, long-term problems can affect the neurons of a person. It causes damage to the nerves and circulation, and it can lead to issues such as constipation, sexual dysfunction, numbness, tingling, and pain in the limbs. It can also lead to dry, cracked skin, and it can affect the sensation and perception of a person and how they feel on their skin. And then for renal, over time, high levels of blood sugar can impair kidneys' ability to filter waste. So poorly controlled blood glucose levels can create an environment for kidney damage, leading to failure or dialysis. Type 2 diabetes occurs more commonly in adults. In fact, it used to be called adult onset diabetes, but type 2 diabetes in children is on the rise, fueled by the obesity epidemic. Family history and genetics play an important role in this as well. There's plenty that you can do to help or manage and prevent type 2 diabetes in children. Encouraging your child to eat healthy foods and get plenty of physical activity and maintain a healthy weight is very beneficial. If diet and exercise are not enough to control type 2 diabetes in children, oral medication or insulin treatment may be needed. For adults, more than 34 million Americans have diabetes, about 1 in 10, and approximately 90 to 95% of them have type 2 diabetes. Type 2 diabetes most often develops in people age over 45, but more and more children and teens and young adults are developing it. It's important to recognize the symptoms of disease because if left untreated, it may create many complications. And for diabetes in elderly, more than 25% of the US population aged 65 and over have diabetes. Diabetes in older adults is linked to higher mortality, reduced functional status, and an increased risk of institutionalization.
So, unfortunately, there really isn't a way to prevent type 1 diabetes. It's completely all genetics, and once you have it, there's nothing you can really do to prevent it or make it go away. But there are a lot of treatments now that make type 1 diabetes extremely manageable. The biggest thing with type 1 diabetes is that you will most likely be prescribed insulin that you'll have to be taking regularly. Aside from that, it's important to be eating a healthy plant-based diet, exercising, and monitoring your blood sugar levels through what you're eating and all that. So what you can do to prevent diabetes is there are a lot of achievable lifestyle changes you can make, such as monitoring your diet and getting more physically active. And these are things you can do to prevent type 2 diabetes and also manage it if you have it. One of the things you can do is learning how to be active. Just do something simple like going on a walk or doing simple workouts every day can really help monitor that. If you can work with a trained lifestyle coach who can help you take small steps and learn how to be more mindful of what you're eating and what you're doing every day. Another thing is discovering how to eat a healthy plant-based diet and adding more greens and foods with low GI indexes. Knowing how to manage stress and stay motivated are also extremely important ways to be able to manage this issue. So one of the most important things with diabetes is knowing how to eat, because you always need to be mindful of your blood sugar, and different foods affect your blood sugar differently. So the GI index is a great way to tell how common foods will affect your blood sugar level. So each food has like an assigned number, and you want to find foods with a GI of 55 or less. So most simple carbs and sugary foods are going to have high GI indexes. Eating a plant-based diet of unprocessed foods is probably the smartest way to go. Along with that, there are so many substitutes now for some of our favorite foods that make things a lot easier. For example, instead of white bread and just the standard pasta you eat, there are so many substitutes now, like with quinoa flour or chickpea flour, for example. And obviously there's so many other examples, but that's just one of the biggest ones, just avoiding simple carbs and sugary stuff.
So why is it important to educate people who are pre-diabetic at risk for diabetes or maybe already have diabetes? And it's important because obviously this is what teaches them to change their lifestyle and either start eating healthier or become physically active and help them manage their diabetes or help prevent them from getting it in the first place. So there's a lot of evidence that suggests that education is very effective in creating behavior change. So for example, there's a national diabetes prevention program, which has been scientifically proven to reduce the risk of type 2 diabetes. It's been shown to be very effective. And also self-management education programs, so programs that teach participants to manage their diabetes on their own, have resulted in decreased A1C levels in adults with type 2 diabetes. And A1C level is basically a blood test that measures your blood sugar levels over the past 3 months. And interventions involving knowledge and metabolic control were shown to be the most effective forms of intervention for diabetes patients. So what this means is that if there is an intervention that involves educating the participant and teaching them how to control their metabolic levels, they're going to be the most effective ways of either preventing diabetes or preventing it from getting even worse than it is. And now a large issue is that these educations don't reach underserved individuals and at-risk communities. As we saw earlier, minorities are at a much greater risk for diabetes, and same with people that are of low socioeconomic status. And this is why it's important to highlight telehealth or online programs, because they're a lot easier to reach. People don't have to go to places in order to get help. And these programs also have a lot of evidence suggesting that they're effective as well. So it just adds another avenue for health professionals to use in order to educate people who are at risk and prevent diabetes from progressing. And lastly, in terms of resources for diabetes prevention, there's quite a few. A lot of the resources I have here are found on the CDC website, but the first I want to mention is Assuaged 21-day free meal plan, which can be specifically tailored to those with diabetes or even those who may be pre-diabetic. And it emphasizes a plant-based diet that is both healthy and delicious. There's a lot of like fun recipes that are on the website. And just the website in general has great information about health benefits specific foods have, foods to avoid, and there's even a lifestyle guide that can help people create positive behavior change outside of their diet. So things such as physical activity and their mental health. And then another resource right below that is an online booklet from the CDC about preventing diabetes, type 2 diabetes, which walks you through your current risk and steps to take based on your responses. The third resource listed is to the CDC website, where you can find information about joining a diabetes prevention program. that may be in your area. It breaks down why to join, the details of the program, and even offers testimonials from other patients or participants. And in the details of the program section there, you can find information about programs that may be near you. And next, there's a pre-diabetes risk test where you answer a few questions about your health behaviors and they tell you your risk for pre-diabetes based on your answers, which is super helpful because it allows anyone at risk to get help early on before diabetes develops. And next, there's a personal success tool that contains 8 unique models that are specifically designed to help participants create healthy lifestyle changes that prevent type 2 diabetes. These modules are centered around, thank you, Cynthia, for putting the links in there. Appreciate it. These are centered around healthy eating and physical activity and provide resources for maintaining a new behavior change. And lastly, there is also a Medicare-specific diabetes prevention program. So if you or a loved one who has Medicare would qualify for this program through the CDC, which is very helpful.
Okay, so we can begin with our discussion questions that we have. So to start off our discussion, our first question was, what can I eat if I have diabetes?
So we're all kind of pitching into that. Awesome. Well, I would say if I could just start it off, plant-based, vegan foods, I would say is very healthy for people with diabetes. I know sugar could really spike, it's not like when your blood sugar is low, it's not good to eat a chocolate donut or something, maybe orange juice and an orange would be a healthier sugar to get your blood sugar stabilized. And then walking when your blood sugar spiked, walking, drinking lots of water, exercise, those are little tidbits that I know in terms of dietary restrictions with plant-based, but definitely want to stay away from the boxed processed foods and stuff like that. What do you guys think? What do you think?
So for diabetes, so obviously plant-based is great, but some people might not choose to go vegan, and if that's your case, then make sure it's lean meat. Stay away from red meats, bacon, like any beef, burgers, things like that. Fish, specifically salmon, cod, things like that. You can always choose any other fish, but those fish are very accessible and very clean and high in omega fatty acids. And then chicken is always just a great way to go. And then when it comes to eating meals, a balanced diet is your best bet. So let's say, you can have like your whole wheat pasta, but you want to make sure you have enough fiber to go along with that. So you have the greens, the salad to go along to help push through any excess sugar through your body. And if you are going to have, if your blood pressure is low while you have diabetes, because when you take insulin, there's a risk for your blood pressure to go too low. Fruit is a great way to go, but instead of juice, the problem with juice is a lot of it has a lot of, like, depending on where you buy it or what you get, added sugars is a huge issue. And a lot of juice gets rid of the pulp. The pulp is the fiber. So to eat the fruit straight up, you will still get the fiber plus the extra nutrients and vitamins within that fiber to help push through any excess sugar. So you're getting the boost that you need, but making sure it's not too much that you just have an overload. And just making sure everything's well-rounded. Again, always talk to your doctor if you have any questions. And again, processed foods is also a good bet not to go down because lots of them, even if it says like no added sugar or something, that doesn't mean the sucralose that they added in there isn't going to affect your blood sugar levels.
Awesome. I love that. Does anybody else have anything to add?
Well, I think she covered it all. Yeah, that was a great response.
Yeah, and kind of touching base, like even though we are a plant-based vegan brand, there are healthier meats out there. Chicken would be one of them, and selecting organic. Our dogs are not vegan. We feed them, organic chicken and wild-caught Alaskan salmon. Myself, I do dabble in some salmon here and there, so I'm not 100% vegan. So it's all about finding what works for you and your diet, and you have to be more frugal when you're diabetic. You don't have time to waste. And I'll tell you right now, my husband and I, we watched my best friend die from this disease. We had taken her to dialysis every day. We met our husbands together. It was a very intimate story, and it was very tragic to see her go out the way she did. So I would it is genetic, and it's very hard to avoid in that respect. So diet is just so important. So thank you for covering that, team.
All right. So the next question we have here is about how do we think we can address this issue at multiple levels? So from an individual standpoint, an interpersonal standpoint, community, or even a public policy level. Like this is kind of just a brainstorming thing. What do we think could be addressed better?
I think one thing that could be addressed better is just like it was mentioned earlier, a lot of lower class people aren't like, they don't really have the right resources or education to live like a healthy lifestyle. So that would be one route to take to make sure that the people are getting educated and they have the right resources to not have this be a problem later on.
Right, and I think that goes hand in hand with what we were saying about the percentage of them that are uninsured. Because if you don't have access to these resources and these people who know the dangers of it and they want to advise you on it if you're at risk, you might not have, like if you don't have access to that, you're not going to know. It's simple as that, especially since the symptoms come on so easily and so unnoticeably. It can really creep up on you, and that's what makes it dangerous.
Yeah, I think another issue is healthier foods are a little bit more expensive to come around than not so healthy foods, and that's probably a big factor as to why people are developing diabetes, like in the lower socioeconomic statuses. They just don't have the means to get, like, they might know that they shouldn't be eating unhealthy foods, but they just don't have the means to provide the right diets for themselves and their families.
It's very interesting because when you look at it, sometimes it feels like, how can we win? Because, lots of people do know that they need to eat fruits and vegetables. And even if they have like in a market, lots of places do have markets, even in low socioeconomic areas that are like very, whether they're open air, like farmers markets or something else. But the problem also goes to produce. It does expire quicker. Like, it's just a fact, especially if it's organic with less pesticides or preservatives. It does expire quicker. So the problem also goes to, do they have the time? I mean, many of these people do not. They work multiple jobs, and it comes down to, can they go to the store to get these new, like, fresh produce every 3 days and pay for that much? You have to pay for more because the calorie load for fruits and vegetables is a lot smaller. You get like 50 calories from one orange. So you have to have, like, if you want to have all the calories you need, you have to add, it's a lot of vegetables, it's a lot of fruits. So well, yes, fruits and vegetables may be like, $1 for, a pound of this, or however it may be. You're buying a lot, and especially if it's every 3 days, it really adds up. And then you have to think about the factors of refrigeration, things like that. If people do not have access to power, if their power shut off, if they try to reduce their power as much as possible. So this all comes down to really, public policy and really tackling the poverty rate in America and the, minimum wage and all these things in order for people to, even if they have the education, they need to have the money to be able to do these things, because unfortunately, whether we like it or not, money makes the world go round. And another thing is with education is screening. So if you do go, well, unfortunately, a large amount of the population does not go to a primary care provider because they cannot afford it, or they just don't have access for many reasons. But I think a big thing to do with education is lots of people don't know. It is recommended by the U.S. government and the I forget the official name, but the Diabetes Prevention Association or something like that, to get screened every year for diabetes with a glucose panel, like a blood panel for your glucose levels, at the age of 45 and up. So if you're under 45 but have high risk factors, then you need to get screened as well. So when it comes to people who don't have that access, finding a way to create a community program where it provides free screening in these areas where people have lower income and don't have much access, setting up a quick clinic or something like that for people to just come in and get this screening, because while around 27% of 65-year-olds and older have diabetes, there's a lot that is undiagnosed, and there's a lot that is people who are pre-diabetic who don't know it. And so screening is a very valuable tool that comes kind of after education.
Those are some really good points, Catherine. Thank you. All right, and we have one last discussion question. How does Assuaged's mission coincide with preventing diabetes? Assuaged is all about living a healthy lifestyle and becoming the best version of yourself through a healthy diet. Healthy dietary habits and exercise have great benefits for immunity and overall health. Consuming plant-based foods is a powerful tool for preventing, managing, and reversing type 2 diabetes. Assuaged does offer, like Evan mentioned, the free 21-day meal plan, which can be found on their website. And studies have also shown that a plant-based diet can dramatically improve the overall health of individuals who have type 2 diabetes.
I love that, you guys. This was such a informative, concise, live discussion that we've done. We just started doing these with the team because it's so important. Public health, we all have to band together and to speak about these topics that people are going through, struggling through. And so if we can be that beacon of light to provide a better road to them to find longevity and better health, that's what it's all about. So I really appreciate all of these amazing students being on the call. I would like, Emily, have we heard from you much on the call? Did you have anything to add before we hop off?
No, I just had a couple things to say about the previous discussion, but I think we caught up. So I don't know if we have time, but that's okay. We don't have to.
Yeah, we have about 25 minutes. Yeah, that's why I was making sure everybody had a time to speak before we hopped up.
I think it was discussion question 2 when we were talking about different policies and what to do in an individual, and community level. And I think with like we've been talking about, type 2 diabetes, is developed later in life. And so we need to start building, life long prevention skills. So I think that where we need to start is with, children and teens, and, policies and prevention strategies in schools, like school meals and programs, and improving health classes for children. Because, when you're growing up, this is when you're learning, all your basic lifelong skills. So I feel like, putting that in the brain of children, about healthy eating and exercise, it's what's going to carry them through the rest of their life. So I know that's what I've kind of been focusing on in school, and learning about in a couple of my children's welfare classes. So we've been just learning about different programs and how to improve the school systems in terms of nutrition and exercise.
That's definitely a good point. I mean, like the slides were saying, more and more kids are becoming obese and diabetic, so it's really important to tackle it early on so they don't have complications later on in life.
Yeah, and a lot of children have parents who were growing up 20, 30 years ago, where maybe nutrition wasn't as talked about and wasn't as a big deal, so they didn't really see it. So when we can have the kids, children go home and, say, Mom and Dad, like maybe we could start, buying more fruits and vegetables and things like that. I feel like, that's important to, keep caring with them.
I think also, sorry. But once that continues, once we have that firmly placed in the education system and, generations grow up learning this stuff, it won't be as big of an issue. But right now, a lot of parents, like you said, haven't had this education. So maybe, for the next, what would be needed for the next, 30 years or something is just adding these information sessions at schools for parents to be invited to as well, to teach them. Because unfortunately, lots of adults don't necessarily like to listen to kids, or they're like, it's and also a kid might not be able to articulate to the same degree as an adult what they learned. So I think that would also be a good step for the generations whose parents have not learned these things yet, to make sure, because if you teach the kid but the parent refuses to buy or doesn't understand where to buy or what to buy, then the kid still doesn't have that access. So I think adding that to that child education element would be really good.
Yeah, definitely.
I put Janan on the spot. Did you have anything to share, love?
I think everyone mostly covered it, but I do think a lot of it is extremely important to just be educating others. And what Catherine was saying, I didn't even think about, if we educate the kids, but the parents aren't willing to listen or, know what to buy or know what you can be doing, then, the kid is still not in a situation to where they can live their healthiest lives. So I do think it's important that we continue to educate the older generations and just continuing to do everything we can to make sure that people have the opportunity to be able to live their healthiest lives.
Amazing. And that is so true. Yeah, the concepts. And Evan, I'll put you on the spot now.
Yeah. So I think another important aspect of this is what the normal thing is to do in your cultural surroundings. So what your friends think is acceptable, or you're saying, your parents or other people around you, and what is considered normal for them. So for example, when you hear physical activity, some people might think, oh, I have to go to the gym for 2 hours and try to look like a bodybuilder, when in reality for health, it's not just that. It also includes just going for a walk with your friends, or just gardening, or some type of physical activity that just gets you moving and that you also find fun, because that's what's going to make you want to do it. And same thing with eating. That's the importance of a fun recipe that includes good substitutes for guilty foods for you. So it's a way for you to eat healthy, but also still enjoy it. Like it doesn't have to be boring. And I think that's an important aspect that a lot of people forget about is that being healthy doesn't mean you have to sacrifice having fun or living your life to the fullest to the entire extent. Some things are going to be sacrificed, but that's a trade-off. So I just think it's important that we continue to work towards changing those norms in the society about what is considered healthy and why that's not always a bad thing. It's not always something's being taken away. It's allowing you to live to your fullest extent. So
Awesome. Thank you so much for sharing. And this has just been an amazing, wonderful team with everybody on here. Thank you so much, Soleil and Evan and Catherine and Emily and Janan. Would love for you to kind of go ahead and end the show, Soleil. And we'll definitely be back for another session next week with more students. And we're just excited to be able to do this.
Awesome. Thank you, Cynthia. Yes, thank you everybody for participating. And like Evan was mentioning, it's not about sacrifice. It's not about giving up, it's not about giving up the good foods and eating just raw vegetables. There's so many different recipes out there that you wouldn't even think like, oh, this is actually healthy for me. There's so many different alternatives out there that can allow individuals to live a healthy lifestyle, and exactly, you can still be healthy without giving up good foods. And that's there's so many recipes on the Assuaged website that you can check out and implement into your daily life. And I really enjoyed this live discussion.
You rocked it for your first time. I think everybody kind of did their first time on here, so it was amazing, you guys, and that's what it's all about: public health, public speaking. It's an art, it's a craft. So we're mastering that craft together, and it was just so much fun to sit here and talk with all of you, and especially about diabetes. It's so critical to get that kind of awareness out there. So thank you for being a part of it, team. Yay.
of course.
Awesome.
Thank you for all the great comments in the chat as well.
Thank you.
Very interesting.
Thank
Yeah.
you.
Oh, we got a lot of good chats, you guys. So
Oh
yeah,
yeah.
I think next week, I forget what the topic is going to be, but we will definitely get it up on the channels for everybody to see, and we'll get more engagement as time goes on with all these topics, and just really excited to do this with the team. Yay. All right. So we should log off now? Sweet. All right. Well, we will go ahead and wave bye to everybody, and we'll see you next time. Thank you for joining us.
Thank you.
Thank you.